presenter is Professor Sridhar Venkatapuram. So Professor Sridhar is an academic practitioner in global and public health ethics and justice. He is an associate professor in global health and philosophy at King's College London and deputy director of King's Global Health Institute. He conducts impact-driven interdisciplinary research that aims to improve our understanding and realization of health equity and justice. He is known for helping establish the area of health justice philosophy, for engaging with and advising public and global health practitioners, and for amplifying ethical reasoning in public and global health education research and practice. The professor was educated at Brown University, at SOAS, at Harvard University Public Health, and Cambridge University Sociology and Political Philosophy. He has worked at or advised diverse organizations such as the UCL, the Human Rights Watch, the Population Council, the Soros Foundation, the Doctors of the World, the Minorities Rights Group International, the Health Foundation, the Wellcome Trust, the World Health Organization, and the NHS. Since 2020, he has served in various advisory roles in global and local COVID-19 responses. So that is our presenter for today. And our discussant is Dr. Ntimi Mtawa from the University of Dar es Salaam. So our presenter will be given 30 minutes, and then our discussant will be given 10 to 15 minutes to give his response. So 5 minutes before time, I will give a sign just to remind our presenter of the end of his presentation. So over to you, Professor.
Thank you very much. Good morning, good afternoon to all of you. Thank you very much for this invitation. It's been something that I've been looking forward to for a long time. So I just want to do a couple of technology checks. Can you hear me and see me okay?
Yes. Yes.
Right, wonderful. So my technology only breaks when something important happens or when I need to do something important. So I just wanted to warn you that it's likely if something happens, I will be back. And so just hold on for a second and I'll sort of connect back with you. And I'm always on email if you need to reach me. So I really appreciate this opportunity. And I think that, you know, many of you, I'm assuming, are working in education or slightly in overlap between health and education. I am thinking that you have invited me because you're interested in how I think about health and how I think about justice in a global setting and think about health and how this could be applied to education, perhaps. I don't want to spend too much time on the relationship between health and education, but it's profoundly important. You know, just in a very basic sense, for me personally, the relationship between education broadly understood, not in terms of just formal education, but the capacity to access information, to understand it and to use it and to have all those different kinds of possibilities of knowledge is profoundly important for health and for life itself. This is something that many people who were working on the sexual and reproductive health of girls and women have profoundly saw many decades ago, in which basic knowledge and information to be able to have access to it and to be able to use it and to be able to you know, ask questions and produce knowledge that's relevant for the health of girls and women, continues to be today not only life saving, but also incredibly socially controversial. And so the idea of people being educated in order to be able to live the kind of lives that they want to live, but also just to stay alive, is something that is not as easy and obviously accessible as we want it to be. The second time that this became a very important and profound relationship is regarding the spread of HIV/AIDS in the early 80s and 90s, where it became very clear that knowledge, once again, information, knowledge, access to information, and all these other kinds of ways that education, knowledge, and the process of learning and reasoning is actually life-saving. And it can be life-saving not only for individuals, but for entire communities and social groups. So I think, we could have a whole day and a week-long seminar on the relationship between health and knowledge, health and education, health and reasoning. But I think that today, what I would like to do is talk about something that's happened over the last 3-4 years, which many of you will, rightly guess what I'm going to talk about. But more importantly, I want to talk to you about some of the things that I've learned from these last 3 years, and then sort of put down into words, because they have something that are for new to me, but also I think it's worthwhile to think about for you as people who are both interested in and engaged with a global architecture and system that affects our daily lives, and particularly your daily lives. And I'm saying that in terms of me sitting in London versus you sitting in sub-Saharan Africa in an LMIC. So my basic contention is, as of today, and I think I'm becoming more stronger, is that the global architecture and governance system is not good for the health and well-being of people, particularly most people who live in low and middle income countries. This is, a very simple and seems like a benign statement, but it is not. It is something that goes against decades of storytelling and narrative and belief that somehow the global architecture is meant to safeguard and promote the health and well-being of human beings on this planet, and that it has been making great strides over many decades, improving life expectancy and health and quality of life of everybody everywhere in the world. But I think that over the last 3 years, it's become very clear that this global architecture, this global governance system, the processes, the institutions, as well as the norms and values are actually not good for the majority of human beings, particularly in low and middle income countries. They are very good for rich people in rich countries. And it's very clear that that has been sort of proven to us over and over again, that this system is geared and was set up by certain countries, and it actually benefits those countries with particular people in those countries. So why do I say this, and why do I start with this? So just for the basic, you all work on very specific topics that you, I'm sure, are passionate about, but I just want to ask you about this one basic question over the last 3-4 years, because you've all been paying attention to the world. How many people have died from the COVID pandemic? Can someone tell me? Yeah, that's a good guess, ballpark, but give me a number. How many millions have died?
25 million?
Actually, no, there is no number. We don't know. Some numbers are recorded, they're not recorded, in my view.
That's Ntimi, that's true.
So this should be shocking that you and we all don't know how many people have actually died from this global pandemic. Every rich country knows how many people died in its own country, but we actually don't know how many people have died in the world. So to make sure that you pay attention from now on, as of today, the official statistics say that 7 million people have died in the world. Okay. But there is another data point that I want you to appreciate, which is called excess mortality, which is that the number is not just people who died from COVID, but because of the ways that we dealt with the COVID pandemic in terms of poor policies, poor planning, shutting down systems, not being able to follow through, etc. That means that people died in road traffic accidents and then had nowhere to go when they needed help, or women died at home because they couldn't go to the hospital. People died of other diseases because they didn't, and the hospitals weren't open. Or even in rich countries, ambulances did not take people to the hospital. They just left them at home, said, you know, we can't take you. So people died at home. So the number of people that have estimated to die as a result of the pandemic that would have been alive had it not been for the pandemic is somewhere between 24 to 31 million people. Right? So 24 to 31 million people have possibly died and likely have died. And this is from The Economist magazine, who doesn't really guess about these things. They really do, or have been defending it from the beginning. And so 31 million or 32 million people have died in the world. Most of these people are in low and middle income countries. And that is the really important thing. And it's not over yet. And as of yesterday or last week, is that there's a new variant that's been taken up that's sort of showing up to be spreading in the UK and other places as well. And I also want to tell you that many low and middle income country governments are no longer taking up vaccinations or offering vaccinations to their people. So that means that a significant number of people will die year on year for the next decade or more. And because many low and middle income countries are basically saying, well, this is just one more thing that we have to deal with. It's not necessarily the most important thing. So why I want to, I'm starting with that, is that I want you to just feel whether you think that this is a natural tragedy, this is a natural event that's tragic, or whether this is unjust because something has been done or neglected, that we as people have, could have prevented this, or could have made it eat less, or have actually made it worse. Because a significant difference between something that's tragic and something that's about justice is that we as human beings had a role to play in it, or could have prevented it, or could have done something about it. Because we don't talk about tragedy as being unjust. We say, oh, that's tragic. And this is the entire story of my work, is how to change something that people think is a natural event or a divine event, or is because of what people as individuals do, to show how actually the causes and distribution patterns and the impacts are all actually socially created. They're not natural events, and they're not divine events, and they're not about individual choices, but actually socially created. So one of the aspects of this pandemic has been that many people cannot understand that this pandemic is a human-made situation. They think it was an accidental natural event, or they think that it was made in a lab and escaped, and so it was an accident as well. And somehow, sort of spread around the world, and governments tried their best to respond, and then science came in, saved the day by inventing vaccines, and then that has solved the problem. What I would look and what I would ask for you to think about is the fact that every day there are outbreaks of various kinds of diseases. And this particular outbreak in December of 2019 happened in a situation that was created by policy and neglect. So that origination is not a natural event, but actually an environment that has been created by human beings. And then the virus spread around the world, not accidentally or magically, but in human beings through social activities and interactions. Human beings went across the world on airplanes, and they went from major sort of capital to major capital, and then it sort of spread around the world. And so to me, that idea that we created it and we spread it, and the way that each country responded to it was because of the choices and neglect it made, makes it a question about justice. And it's about more sort of profoundly compelling because this is about life or death. And this is about whether people live or die and what sort of quality of life is done. Now, in about 2021, I think, I was asked to write about what does this actually tell us and what have we learned and what do we want to know for the Journal of Global Ethics. And what I have said to you so far is nothing new for me. And it's nothing new that if you and I spent some time together that you would also sort of say, yeah, that makes sense. It's not a big, but there's three things that I learned, particularly about the capabilities approach that I want to talk to you about, which I think also has relevance to some of your work or hopefully your work. I'm assuming that many of you are working with the capabilities approach. I shouldn't, but I'm assuming that you do. So you know the basics, particularly because of your professor. And so you're sort of fairly entwined with it. So the three things that I learned was particularly focused on the capabilities approach. So one is that we in the capabilities approach have focused so much on the individual and this notion of individual well-being as being multidimensional, and that we should think about it in terms of capabilities, which I think is still absolutely valid. What we have not done, and sometimes we did this at a national level, thinking about how does a national policy affect capabilities at an individual level. We have not looked at the transnational plane and looking at the institutions and policies, norms and values, and how they impact individual capabilities or other kinds of issues around the capabilities approach. So let me just dive into this a little bit more. We have, sort of said, in most often we said the thing that we care about is individuals and their well-being and in terms of their capabilities, and education is one of the really important capabilities. And I also think that health is another important capabilities. We often think about, the kind of local environment and what are the different kinds of factors that cause capabilities and expand and constrain. And we also try to link that to a national environment and policies, and how do we think about what sort of governments can do to either support or remove the constraints or enable, etc. What we have not done in the capabilities approach very much is sort of say, wait a minute, the actual air that is being breathed in a national context is being determined by global factors. The actual policies, the amount of money that a country has, the ideas that are allowed to circulate, the frame of, sort of reference, the shocks that countries feel don't come from the inside many times, they're coming from the outside. But we in the capabilities approach have really not sort of looked at the institutions at a global level. We've often used the UN institutions such as the UNDP, for example, as a place that we can say, this is a place which sort of helps us look at national level well-being of life. What does the UNDP actually do for the capabilities of people around the world? Or what does the General Assembly do? Or what does the World Health Organization do? What does other non-UN organizations, like what does Facebook do? Or what does Twitter do? Or what does the IMF do, etc.? So I think that this is very significant because we had a pandemic that killed close to 30 million people because of failure of international institutions and governance mechanisms and processes, that it was sort of hijacked by certain groups or certain countries, despite the rhetoric of being globally interconnected and having solidarity. The actual reality was that the global architecture and governance system was used to help certain countries and not every country. So I want you to think about, and whether you think I'm correct in thinking about whether the capabilities approach has really given us enough sort of skills and tools to be able to look at this sort of supranational, transnational level as well. The second thing that I want to highlight is that it became very clear over the last 3 and 4 years that these powerful global institutions actually do not have any internal mechanism or capacity for ethical reasoning. So what I mean by that is that the WHO, the World Bank, the IMF, the UN Secretary General does not have any office or any individual that can help them think through what does the ethics or equity implication of this policy or this event mean for us, and what should we do, right? So what you had, for example, in the WHO is that for 3 years, the basic idea of ethics and equity that the Director General was talking about was being written by his speechwriter, not because there was somebody in the organization that could actually say, this is what injustice means in the world, that older people are dying unnecessarily because we've neglected them, that is unjust, etc. Those kinds of words weren't being sort of provided by a person or an individual in these organizations that could, help, educate the world, but also ensure that there's coherence from the institutions. Instead, the speechwriter on that day was like, oh, we need to talk about equity today, and so we're going to write a speech about it. But the same is true in places like the Global Fund and the Gavi, which is that Global Fund in a crisis situation had to decide, what do we do about, distributing our X sort of amount of resources? How do we decide who gets it and who doesn't? And the person that was in charge of it was the person who also had ethics in their job title, but their ethics is about compliance, professional ethics. So all these organizations have big offices for ethics, which is essentially sexual harassment, corruption, lying, etc. That's their understanding of ethics. And then when we had to decide how do we distribute different kinds of resources, then the person with the word ethics in their title got told that you have to decide how you're going to distribute these resources in various countries, and they did that as well. So that's one, so that's the second thing that I learned, which is that we had assumed, because we work in the capabilities approach and we think about the UNDP and the UN, and we assume that the capabilities approach is very influential in these organizations, and that these organizations have the tolerance or the capacity to think about ethics and philosophy and equity. But in fact, many of these organizations do not. And this is, I think, a really big problem, is that if you don't have someone at a very senior level being able to appreciate what does equity mean and what does do we decide, how do we think about what the right thing to do is in this kind of situation, you are going to be driven by political actors who are going to make political decisions only about what will get them through the next cycle, this next election, this particular crisis. So I think that is a second thing that I really, kind of woke up to, and I think that requires us to think more about how do we advocate for a role for ethics and ethicists and people who are aware of what does equity entail, and how do we think about it not only within countries but across countries as well. And the third thing that the capabilities approach does not do well, but I sort of argue that it's been doing it all along, is to deal with racism. So I am more and more become much, much more vocal in the level of racism that is in health at a local level, which is very clear. So, for example, I live in London and the NHS. There's a lot of bad things that are going on, but I think racism is clearly one important thing. It's happening at institutional level and then national level, and the UK is a very interesting place right now because it has an British Indian prime minister, and Scotland has a Pakistani background Muslim first minister, and the mayor of London is a Bengali Muslim man, etc. But then most of England thinks of itself as white and sort of scones and tea and etc. So there's something going on here, but there's a big conversation happening in the background about what this is going to do. But irrespective of that, the capabilities approach, if you look through the literature, has dealt a lot with gender inequity, etc., has dealt a lot with, sort of poverty and it's all stuff and gender. But it hasn't dealt with a number of other things. So, increasingly we've been dealing with disability. But what I found is that we've been really quite silent on racism. And we need to think about from both a philosophical sense, but also in a practical, everyday sense, how does this impact sort of capabilities of individuals? So when I went back, what I saw was that actually Sen does talk about racism, but in this very polite and genteel way. And I think that this is more about him than about his feelings about the issue. So, for example, there's a very famous essay about, rights and the whether you can be an egalitarian and whether you can also respect rights. And he talks about, instead of saying person A, B, and C, he says Ali as person A and B as, and I don't remember what the name was. And the idea was that in order to prevent a racist attack on Ali, you have to break into the house of B, right? So the idea is that in order to protect one kind of rights, you have to break into stuff. But that's the kind of work that the capabilities does. It's a very kind of separate and genteel approach. And I think that we need to be much more upfront. And it's not as though we haven't at all dealt with it. We have been dealing with some extent. But I think that this is a significant sort of issue, and I think that it needs to be brought much more to the forefront, not only in certain countries, but I think, as I said, more importantly in the global system. And we in global health and also health have been raising this as being a significant issue, that racism in global health is a very real thing, and it needs to be addressed. And we have a big sort of conversation and a power struggle going on as a result of that. So these three things, which people who are interested in the capabilities approach may also be looking for, interested in how it might be applied to them. One is, how do we think about the global transnational level and capabilities? Second is that there are now all these organizations, government organizations, UN organizations, private organizations, that do not actually have the internal capacity for equity and ethical reasoning. And third, I think racism has been too sort of gentle in the capabilities approach, and we need to bring it up to the forefront on something like that. So with that, I hope that I've stuck to the time. My clock says that we're coming down to the 30th stuff. And I appreciate this opportunity again. And I also want to apologize. Brown bag lunch usually means here's some couple of ideas that I'm thinking about. So I apologize to my commentator and discussant that I didn't provide this paper many weeks ago so that they can have a chance to look at it. I hope that nevertheless they're able to comment, and I don't mind if it's just a free flowing conversation, and I look forward to your questions and comments after that. Thank you very much.
Thank you so much, Prof. Right on time. Dr. Ntimi, you can take the floor now.
Something. Just with connection. It's not mute. Oh,
what's his name?
He just lost power.
He just lost power. Oh, then I'm just, very open for questions.
Okay, as we wait for Dr. Ntimi to probably come back, we can take some questions from within the room, and also those online. You can just raise your hand and then pick up the questions. So we can start with the room. Any questions, comments?
Yes, thank you very much for this nice presentation. I was just reading your profile. It was amazing to see that you were examined by Amartya Sen, and your thesis passed without corrections. I have one question. You've nicely highlighted the limitations of the capabilities approach. And as a person who has written a lot on the CA, what then would you propose in strengthening the capability approach to address issues such as racism in global health or in education? So apart from these limitations, what else do you propose then?
Okay, maybe before he answers, we can pick two more and then he can respond to them at a go.
Mine's quite muddled, but I'll try. Okay. Hi, Sridhar. So mine's a bit unformulated because I'm sort of hearing some of the arguments for the first time, but I'm going to give it a go. I mean, one of the things, I think the 3 points that you make are really important. But it's one of the challenges or the problems when you sever the capabilities approach from human development. So that you don't anchor the capabilities approach firmly in processes and practices of human development. It seems to me that if you do that, then certainly your first 2 points about the transnational and the silences would come up because human development works on that sort of global scale. Yes, the UNDP might provide country reports and so on, but it's, my sense is that it's operating on a global scale. So it would, it would take you into that space. The second point about ethical reasoning, I think is more tricky, even if you are anchoring the capabilities approach in human development. And I think it's quite challenging. And I want to speak about it very specifically from the space in which I find myself. And it's a bit like Edward's question. It's a bit of the, well, the so what, or so what are you going to do about it, having made that point kind of thing-ish. I think the point about these global institutions, that remember that we do not experience them as spaces of justice. So we're very aware of the fact that these sort of global drivers and so on are not necessarily working in our best interests. When they were dishing out the vaccines and so on, we were very aware where we stood in the pecking order. So as a country, as a nation, as a continent, I think we're very aware of the fact that we are, we're not first in line when it comes to global institutions, perhaps in a way that richer countries don't think about. So then to introduce ethical reasoning into these spaces so that there is thinking about the right thing to do, which I think is absolutely admirable, but the political will always triumph. That's my worry. This is a debate I've just had with some colleagues from Europe, where I think there's such a strong assumption about functioning democracies and welfare states and so on, and politics as a rational process. It kind of doesn't work like that. So the ethics sounds to me like a nice to have, but politics will always, get in the way, and so on. So we had a large budget set aside in South Africa for COVID-related things, vaccines and so on, and corruption just turned it inside out. Everybody kind of was aware of the right thing to do was to ensure that as many people as possible were treated, protected and so on, but politics kind of got in the way and an awful lot of money disappeared as a result. So I'm not quite sure how saying this is the right thing to do is going to triumph over the political space, especially in the context in which we live. And then the third thing is a comment. Part of the challenge is that racism over a long period of time has been virtually absent in development. Sarah White was raising this in early 2003. It was picked up by Uma Katari. There was another very recent article by Patel, I think. So it's not just health and it's not just the capabilities approach, which is not dealing with it very well. The whole space of development does not deal with racism or deal with it very well. So, you know, I don't know, I think I've made comments rather than ask questions, but I do think the 3 points that you raise are very rich and very thought-provoking. So thank you for that.
Okay, thank you so much, Prof. Okay, I think Dr. Ntimi is back online. Dr. Ntimi, are you able to hear us?
Hey, can you hear me?
Yes, we can.
Thank you, Chair. I ran out of power. We have it has been happening. You know, just today since morning the power hasn't been stable, so it's on and off. And I missed the chunk of Professor's talk, but the earlier part of it I got it. Well, thank you so much for the talk. And I was reading your paper in the morning, early in the morning, the one you shared, the 2-3 pager, and I was saying, Simon, why are you bringing me into health issues? But the way you coined it kind of gave me a sense of, oh yeah, we're speaking similar language in a way. I don't have much to say in terms of, you know, like giving, you know, discussing what Professor said, but I thought I should frame my response in a more of a constant frame of asking questions rather than discussing or giving a response. And one of the questions that I ask myself is the issue of access, which really is the center of this conversation. In terms of who had access to vaccine, for instance, during COVID-19, and who didn't have it, and why. And it goes back to the issue of, you know, who is more sitting at a powerful position to make decisions. And even in our countries where, you know, we import this vaccine, not everyone had it. Perhaps lack of information, the issue of question of beliefs. You know, what kind of knowledge do you have and information about the vaccine, and do you believe in it? And if you're not, you know, what do you do? You know, I remember I was forced to get it when I went to South Africa because I couldn't enter into the country, but I was not interested in getting it because of my personal position. Those kind of questions for me becomes even more complex, or they add to the complexities of this issue of global justice, to global health issues. But again, also the question of, but how do we address this issue of access and justice if we continue to have these complex layers of power relations between the global north and global south, for instance, which I don't see it ending today or tomorrow. How do we, this dichotomy of global north and global south, which I even don't subscribe to these notions of global south and global north. How do we do it? If it happened, similar kind of pandemic happening tomorrow, are we going to see any change or any different approach? I don't see that happening. So are we going to continue to have this conversation until when? I think it's about time we begin to find more solutions to the problem, because this dominance of global north is going to continue to be there. Then what do we do this side of the world? But even within the national context, there are so many issues that we need to address, political issues, but issue of inequality within our context still are going to determine this issue of. So let's speak about transnational, the global, but what about national level? You know, my colleague from Zimbabwe may attest to this. I was following what was happening in Zimbabwe, but also in Tanzania, we took a different approach to COVID-19, but so many people died. And as you said, we don't have the numbers yet, but the government will say, no. They are just here and there. So many people died, and I know some of people who died because of COVID-19. whether it is COVID or other comorbid other disease, I don't know. But for me, my point is we need to address the issue of access. And access to what? And how do we arrive to that just access to medication or to vaccine in case of such pandemic in the future? So those are some of the questions that for me came to my mind when I was listening to you, Prof. And I said, I'm not giving a kind of discussion, I'm just posing some questions that came to my mind. Thank you so much.
Thank you so much, Dr. Ntimi. Prof, I think you can respond to Dr. Ntimi plus the 2 comments that came from the room.
Yeah, thank you to all 3 for the questions and comments. I'm going to work backwards in my responses. So just going back in responding to Timmy, I think that what I understood from the comments and questions is that the pandemic over the last 3 years really raised questions at many levels, at the global level, at the national level, within the nation, but also at a personal level. So as an individual, you had, and we all had, questions about, what is the risk for me in this crisis, and what are the potential ways in which I can protect my life and well-being, as well as my loved ones around me, and maybe those far away as well. So what I heard from that is that we have a bunch of different kinds of individual level questions for us. And what does this mean in a crisis? And how do we think about our capabilities as an individual level in terms of crisis? Not in terms of, sometimes we think of capabilities as other people's capabilities and what can we do for them and their capabilities. But here we're talking about how can we think through our own for ourselves, and what are the ways that we think about our capabilities, and things like vaccination, and what does that mean in terms of my capabilities being interdependent with somebody else's, and how do we think about those kinds of questions. And I think this is a really important thing, is that learning, education, values, reciprocity, community, all of these things show the interdependence of our capabilities, and we haven't sort of really given enough attention to that. So that's one of the things that I heard from this last comment. The second thing is this question about access. So when we are trying to understand and evaluate our contextual individual level capabilities, we then have this massive global inequity that is geared towards benefiting the better off in rich countries. Then that layer sometimes overwhelms the conversation at the individual level. And so we are sort of confused as to how are we sort of negotiating. But then Melanie is absolutely right, is that we did negotiate it. Many of you did negotiate that kind of tension and are sitting here today as a result of doing that well. So it's not an impossible negotiation, but it's a question about how do we perhaps think about it a bit more clearly and openly. The second thing that I want to respond to that question is that one of the things that we need to start thinking about is that this pandemic crisis is not an exception to the general way of things. It's actually just an acute period of how things are normally. This is not something that's unusual. It's actually just one more crisis that actually reflects the continuous kind of constraints that people are living in regarding their health and other abilities as well. So I think that would be sort of 2 things that I respond to the last commentator. And then before that, in terms of the 3 comments, I think the idea that somehow what I am arguing in that first point about the transnational level is that I would like for, when we think about capabilities and we think about the contextual environment in which capabilities are made or constrained or neglected or enabled, we tend to go very hyper local. we tend to say, okay, the woman and whether the sort of ideas around her household and her village or her town, what affects her and stuff. What I'm saying is that we need to start also looking at the transnational, the extra border issues that are affecting those things. Our causal story stops sometimes at a national level, and what I would like for us to do is start to look at the entire system so that we really appreciate it. What will come out, I think, is that you will find that people who are living in low and middle income countries and the poorest of the poor, the worst off, are more likely affected by global factors than the nice middle class in America or the UK, who are very buffered and who are protected from shocks from the outside. So that's what I meant by sort of saying that we need to be able to think about the global and sort of understand the impact and have that full picture rather than just sort of a local or a national impact. At least ask, is the fact that the fact that this young woman or man does not have access to this particular medication, is that because of a national policy, or is there a global factor that's also determining that? And I think that we need to start sort of giving the full picture of something like that. I don't know if if your comment was particularly about having someone who within these international organizations having the skills to reason about ethics and equity does not mean that I'm saying that politics will not determine the policies. What I'm saying is that politics can be better if there is some sort of clarity about the equity and ethics issues as well. But I also think that you raise a really important question that I've been struggling with, which is, why are we doing the capabilities approach anyway? What's the point of our work here? Is that if we are not philosophers and ethicists at a core and understand our purpose in this, right? So this idea is that we are people who are interested in the capabilities approach are not just fixers. They don't say, here's a problem, here's our solution. It's training us for a way to think about things. And so what I'm saying is that we need to basically make an argument that at the highest senior levels of these international organizations, there should be people who know how to think about things rather than political strategists or rather than problem solvers or economists and all this kind of stuff. That's kind of where I was going towards that. I wasn't making an argument that ethics will dominate or, sort of somehow stop the politics. I think all we can hope for is politics will be better as a result of being able to reason through ethics and politics. I didn't talk about corruption very much, but this pandemic has been one of the most corrupt periods of time in the entire world. I mean, countries like the UK have just seen billions of pounds disappear, and they don't know what to do and what to say, because how can the British possibly be corrupt at this large scale? And so they just don't know how to sort of deal with it. It's too shocking for a lot of people. So I think that what we want is, and this is an opportunity for us to think more about how can we get that sort of ethics and equity stuff. And lastly, the racism part, you are absolutely right. I don't know enough about the history of development thought. I do know that, when I was studying development in the 1990s, all they taught us was famines, and that's all basically, and then it was all about sort of fertility problems and demographic growth and all this kind of stuff. And this is why I don't do development, is that I sort of walked away from it. And I'm more interested in sort of health and this kind of stuff. But so I can imagine that, racism has not been, because also development as a field is dominated by certain kinds of people in certain kinds of places. It's not necessarily, what they're sort of really going to focus on. But what I do want to say, and it sort of pains me in my older age as I get stuff, is to say that Sen and Nussbaum were not really the anti-racists that I wish that they were. They were much more genteel, and maybe because the 90s were such like everything's wonderful now and we're all going to be democracies, etc. But I just feel as though, they could have been much more strident. And even today, I've just started having some conversations about, Sen's attitude towards these other philosophers. And, some of these other philosophers who he had disagreements with were racist, right? They were basically like, who is this brown man who dares to do philosophy? And who is he to be criticizing what we are saying? And how dare he, this sort of migrant who comes to our country? And Sen never says anything. He never names it for what it is. And no one has ever named it for what it is. It's all just a genteel debate. And I think that this is, something that I just don't have tolerance for anymore. So I'm very much more clear about the fact stuff. And so at this point, why should, someone, bring up bad memories? But even his biographies don't talk about these very much, and these sort of very difficult conversations. And so this really raises the question around the personal in this capabilities approach, and how I want to encourage whoever is affected by these issues very directly to actually make this a central part of the capabilities approach and their research as well. So in terms of my solutions, well, this paper was about 3 solutions. One was, let's start putting more global architecture into our analysis. 2, solution is, let's get more people who are ethics and equity trained into the leaderships of these organizations. And 3, let's start talking about racism and racists in our daily lives and in the theory, and how do we talk about quality of life, just as much as we talk about gender inequality and stuff. We can start talking about racism. And if other people say, well, disability is what's really important, I'm all for it. But I'm not afraid of talking about homophobia, misogyny, racism as being fundamental things that are killing people through constraining their capabilities. Sorry, that was a little bit polemical, but I think you all would be on my side. We're all sort of sitting on the same side of the table in this conversation, I think. Any other comments or questions? I see one hand on my screen.
Carmen, you can go on with your question or comment.
Hi, thank you. Thank you so much for such a stimulating conversation also in the room. I think I just have a couple of comments just to keep thinking together about these complicated matters. And obviously, I think everything that has been mentioned face-to-face and online has been really pieces of the puzzle, right? But I just wonder whether the importance are, we don't need to focus on the pieces, but rather on the linkages between the pieces. And I think that's a bit your argument about focusing on ethics and the ethical and the moral aspects, because that will be transitioning to this relational space, not necessarily putting the emphasis on the institutions or the agency, because I think Amartya Sen is quite good when he's telling us or kind of warning us, institutions are formed by agents, we are the institutions, right? And I think the ethical and the moral is, it seems to me that is a lost, not a lost, it's like invisibilized dimension of the capability approach that has not been sufficiently captured by being and doing. And I think we have really good reasons to use the capability approach. And I think this is because the capability approach is praxis, is theoretically and practice driven at the same time. And that's something that traditional theorists have not been doing, or they have not provided us with the tools to do the two of them at the same time. And then I think about your answers to the solution. And I wonder as well what they will think. Sorry, because I have a meeting at 12, so I will need to leave quickly. But I wonder whether racism, xenophobia, homophobia and other illness that we have in our society are just externalizations of a crisis of recognition, as Honeth already warned us in that aspect. And I just wonder, you know, linking with your argument about the moral and the ethical, if it is, you know, we need to guide education towards a new relationship of solidarity that we don't have because our current capitalist and neoliberal system is somehow hampering. Yeah, just wanted to say that. Thanks.
Okay, maybe we can take one last question if it's very pressing, and then we can answer that.
Okay, thank you very much, Prof, for your presentation. So mine is around, I like to say knowledge and reasoning is life-saving. So looking at that, you also mentioned that poor people are affected by global factors and access is limited by local and regional structures. So now maybe looking at the wave of COVID-19, what is the health aspect? What is your view around the issues of health in terms of indigenous knowledge systems, like what maybe African communities were thinking of or wanted to implement in terms of taming this pandemic? And then due to these access and structures within the regional blocks, there were a lot of debates around that. So what's your view on that in terms of considering the IKS in line with health to address some of these issues, especially since the poor people are having a problem to access to maybe some of these vaccines and these other things that are related to that?
Yes, Prof, you can respond to this.
Great. Great. So, you know, I'm just going to do these very short answers. So in terms of, sorry, Carmen, I hope it's okay to call you by your first name, Carmen. And so her, I think, you know, she's sort of highlighting the possibility of a much grander background theory that could sort of help explain and solve many of the connections between these things. You know, I'm not familiar with sort of Habermas and Honeth and, you know, sort of recognition. But I do know that that's something that people are working on, and there's people who are trying to bring together capabilities approach and the recognition that Honeth talks about. And David Miller, I believe at Oxford, who's retired, has been working on sort of basic goods and stuff like that. So I'm happy to sort of be open and sort of think about a much sort of grander theory that would sort of help us connect all these different kinds of things. In terms of the last comment or question, what I heard, I think, was this idea of, you know, local knowledge and practices, right? And so there's two points that I'm going to make quickly about this. One is that there was very much this kind of belief that there is a denial of local knowledge in this global policy agenda that was dominated by, you know, certain places and certain stuff, and that somehow local knowledge had insights that would have prevented this kind of infection or the spread of pandemic. So I think that answer requires more careful sort of thinking through, which is that on the one hand, I think that the global, the WHO, for example, made a profound mistake, but it's not only the WHO, but it's the way of thinking about science that's really at stake here, which is that in science, we think that there's one rule that we can generalize across a population, and that this one rule can be applied towards the entire human population. So the idea of contain and control an infectious disease, that you simply find people who are infected or might be infected, you isolate them, and then you treat them if you can. And that rule was a mantra that they started and saying over and over again, because in science, we believe that it's one simple rule that we can apply it. We, from the capabilities approach, know that every individual is situated differently, and you need to really appreciate what the different kinds of contexts are, and that one generalizable rule will do great violence when you meet the diversity of individuals, which is exactly what happened, and which is what you were talking about, where hundreds of millions of of people were suddenly left out of their homes and starving as a result of that. That is a problem that we have to deal with in the future, which is that you cannot say science gives us one simple generalizable observation and rule that we apply across all human populations or across a whole national population. This is a very, very at the heart of science problem, and it's a philosophy of science problem. And it's going to be a political problem because if you sort of assert this, so we have to see what's going to happen in the future. But I'm hoping that countries like South Africa, where there was a debate that lockdowns aren't necessarily the best thing to do, that there's other ways of doing this, and why did it happen and what were the sort of stuff is a really, I think, a really good example. So I want to, it's a very long answer to your question, but on the one hand, yes, there is one conversation about, you know, what sort of local knowledge could prevent people from sort of infection, but also take care of each other, that sort of contextual, et cetera, that was not respected by national governments or international policies. But at the same time, we also need to appreciate that there was new knowledge and information that needed to be used and sort of spread in local communities very quickly. We have a much bigger problem here. Just like economists might tell you that there's a general principle and we're going to apply it across countries, I'm telling you that even in health, there is a belief that somehow there's a generalizable scientific principle, like how do you control infectious diseases, that sort of, you know, are sort of seen as something that you can just simply, you know, apply all over the world, which does not work and makes things worse. So there's lots more to be done and learned in the future, but it's also something that, as you rightly know, we should keep a watch on in the future when we think about a large sort of health crisis like the one that we just had. So I'm sorry I went over my time, but I hope that you at least, you know, thought about something new things and different things as a result of this chat. And I once again want to thank you for, you know, giving me this time, and sort of it's been lovely to meet all of you, at least online.
Well, thank you so much, Prof, for that wonderful presentation. And thank you so much, Dr. Ntimi, also for the response and for the participation in the room and online. So we can call it a day and just give the last round of applause for everyone.
Thank you. All right, see you. Bye.
Bye.